Let's rejuvenate her under eyes. So something I hear every single day, multiple times a day, is I look so tired. I look worn out. I look exhausted. Sometimes I'm not, but I just keep looking tired. So I'm going to pause this video real quick and talk a little bit about her anatomy. So here's her before and after on the treatment that I'm about to do. You can see she just looks refreshed. She doesn't look overdone, but she just looks less tired. The one thing I notice is, yes, her tear trough is hollow. That direct tear trough is hollow, but more importantly, she's lost volume in that medial cheek. You could see that fat pad in the apple of her cheek has descended down into her nasolabial fold, and she's starting to experience a little mid-cheek groove in that before photo. So my goal is to really project up that mid-cheek groove, but more importantly, you can't over-inject that mid-cheek groove, because you could see here when she expresses, she recruits a lot of that fat pad back up. So if we project it up too much, she's going to look overfilled. The goal is to reestablish support so that it doesn't look like that tear trough is extending all the way through her cheek. Now, one thing that's really important is to look at her pigment. Now, a big part of the reason that she looks hollow is because she does have a collection of hyperpigmentation in that hollow. So in that mid-cheek groove, she has some hyperpigmentation, she has some brown spots. So I talked to her about skincare, I talked to her about lasers in the future to potentially soften that, which we'd need to be very careful because she is a Fitzpatrick 3 and 4, but softening with a little tretinoin, really addressing the skin, will help also make her under eyes and her cheek look more refreshed. You can see here that she has a little bit of that pigment that is making that under eye region look more hollow. So we're going to augment that medial cheek right where I put that little poke or that white mark, and I'm going to project it up so that it rebuilds. The cheek is the push-up bra to the face. So if you do not start with the cheek before the tear trough, you won't have that support in that tear trough. So for this patient, I chose to use 1 syringe of Restylane Lyft for her cheeks and a half syringe of Evolysse Smooth for her tear troughs. So here I am, I'm using a 27 gauge needle and I'm going directly on bone. I always aspirate when I'm on bone, and I'm placing 0.2 boluses at a time. So because we have a limit of 1 syringe for the cheeks, I'm really going to go back and forth to make sure that I augment and project up both cheeks. So you're going to see me go back and forth quite often. I always have alcohol in my gauze because I'm always wiping the area, making sure that I'm keeping the whole area, the injection area, clean. So going back in because I realized I want a little bit more. And I'm going to add another 0.2, aspirating first, making sure I really get a good pull on that plunger, and then staying right where I aspirated and injecting another 0.2 bolus right there. Nice and easy, slow injections. I rather poke a patient another time than put a big wad bolus in her cheek. I am a very conservative injector, so I don't like to place too much product at one time, especially in those boluses on bone. So I'm now going to start working on the other side. Placing again 0.2 boluses. Now what's really important in this area is respecting that infraorbital artery. For me, my rule of thumb is anything medial to the mid-pupillary line, I'm using a cannula really to respect that infraorbital foramen, which has the infraorbital nerve, vein, and artery coming out of it, and that sits about medial limbus line. So for me, I am lateral to the mid-pupillary line, so that's when I choose to pick up that needle and inject a bolus on bone. So always hold a little pressure so to prevent that bruise from expanding, but she's not bleeding too much, so I think she'll be fine. So now, always re-cleaning the area. I'm going to go back in with a little more of that Restylane. I have about, maybe that's 0.4, 0.5 in the syringe left. So I really want to make sure that I utilize it appropriately, because a 1 syringe budget for the cheek can be a little tricky, but really we're not building a full cheek on her. So I was comfortable with just a little projection in that mid-cheek groove with 1 syringe. Typically, if I am building out a full cheek, I want a minimum of 1 syringe per side, ideally. So again, small injection boluses, 0.2 cc's at a time, using my 27 gauge needle. Hold pressure on that little bleeder. but she's really comfortable. You could see she's smiling. But I always have my patients smile and relax. Remember, you are injecting two cheeks. You're injecting a resting cheek and an expressing cheek because you always want to factor in that fat pad recruitment and not make them look overfilled. So now I'm creating my port with a 23 gauge needle for my cannula, and I'm using a 25 by 1.5 inch cannula. Now this is Evolysse Smooth. It's one of the newer HA fillers on the market, and I've been absolutely loving it for my tear troughs. I am injecting or placing that product rather deep, but right now I'm not injecting any product. I was simply introducing my cannula slowly. I only inject retrograde thread. So now I'm pushing product retrograde, but I'm always lifting up that cannula. You saw right there, lift up, so I know what plane of injection that I'm in. So retrograde thread, always knowing where the tip of my needle is, and I am only injecting small, thin threads of product, just fanning in that area to build up that projection ever so slightly. She doesn't need a lot of product, so I'm using a half syringe in total of Evolysse Smooth. Again, creating my 23 gauge port, holding pressure if she has a little bleeder, and then inserting my 25 by 1.5 inch cannula deep. I want the plane of injection that I'm in is when I lift that cannula, I see a blanket over the cannula. If I see a sheet, I am too superficial and I'm running the risk of potentially tindling my patient, which is when you see that bluish hue or darkened discoloration, and that's from the reflex of the light being reflected from the sun on the filler, and it creates this blue hue. So I'm just working my cannula slowly, lifting up multiple times to see what plane I'm in to make sure that I have enough tissue overlying that filler to avoid that tindle. And then retrograde thread, I always place small threads. You'll never see me place this thick wad caterpillar of filler. I'm laying small threads, kind of painting the entire area. And you could see at how much product I'm injecting at a time, just small threads. If you place a big, thick caterpillar of filler, you will see it and it'll be really challenging to blend down. So small retrograde threads just to build that support. Remember, her transformation isn't anything dramatic. She just wants a little bit of a refreshed look. So again, finding the bone, I have about 0.2 left, aspirating. This is Restylane Lyft. And I always leave a little bit to see which cheek can really benefit from that last little bit, especially remember we had a syringe budget for the cheeks. So laying the rest of that product in that medial cheek to really build that support. I didn't add any product into the apple of her cheek because remember when she smiled, she recruited a lot of that fat pad back up, and I don't want her to look overfilled. She would not like that look, and she would be really disappointed. Even if I were to correct her tear troughs, she would feel disappointed because she would look overfilled. And I don't want that look for my patients. I just want her to look refreshed and rejuvenated. So pulling out that needle, it's always a good feeling as an injector when you pull the needle out and you didn't get a big gush of blood. So you can see here in her before and after, she just looks refreshed. That cheek really gave that under eye some support, and we placed a little bit to refresh her under eye directly. I'll bring her back in about 30 days and reassess whether we inject a little more product or we leave it as is, but I always like to stage this and really give the under eyes time with the new filler to do its thing. If you're loving these videos, please hit that subscribe button and help me grow this little baby channel of mine. I appreciate all my subscribers and anybody who takes time to watch my videos. Hope you're loving this content.